Hospice care can carry stigma and misperception, but the bottom line is it all revolves around making a patient comfortable instead of treating an illness. I'm senior reporter Roland Barris, and we're breaking down that stigma in an effort to be healthier together this Wellness Wednesday. The Idaho Department of Health and Welfare lists 48 different agencies providing hospice care throughout the state. Now, hospice can include bereavement and grief counseling for an individual and their loved ones, but it also includes things like diet counseling, physical therapy, and equipment like a hospital bed. It usually comes in places like a hospice center or nursing home, but it can also happen in a hospital or the patient's home. Dr. Carl Steinberg is a medical director for hospice care and says the median length is just under 3 weeks.
Patients who are on hospice for over a year are uncommon, but I wouldn't say rare, probably less than 10%. And we see that more with people suffering from end-stage dementias.
To be eligible, 2 doctors have to diagnose the patient as terminal with 6 months or less to live. But one of the bigger problems, Dr. Steinberg says, is that a lot of people don't get referred for hospice until it's too late.
They're practically on death's door, which in my opinion deprives them of so much of what hospice has to offer to patients and their families.
Yes, hospice can sometimes stretch your budget. However, both Medicare and Medicaid, as well as private insurers and the military, can help cover the expense. Some even provide some co-payment for things like prescriptions or a trip to the hospital. Reporting in Nampa, I'm senior reporter Roland Barris.